Hey guys, what's up? Today I'm going to show you how to somewhat painlessly give yourself a Humira injection. They're not the most pleasant things in the world. I've been giving myself Humira injections for over 2 years now. So I've got some key pointers here to lessen the pain of the injection, because it does sting quite a bit, and some other tips. My first tip is it's best if you let the pen sit out for about 20 minutes. Don't go any more than that. Another thing, and this is a big key, when you wipe with the alcohol, make sure that it's completely dry before you give yourself the shot. Finally, you need to find a good spot where there's quite a bit of tissue that you can pinch up and hold. And then use your injection there. Obviously, you don't want to go into a vein because Humira will be destroyed if it gets into the bloodstream. What you want to do is just kind of go under the skin. Once it's under the skin, that's when the medicine can be sent to the proper places to hopefully get rid of the inflammation. Okay. So the first thing you obviously want to do is get your alcohol pad, which I'm going to do right now. Sorry, I'm trying to hold the camera and do this at once. Like I said, I've probably had over 50 injections, and it has been working well. So, as you can see, I like to do mine in my legs. I'm not a big fan of doing them in the chest. So, what you do, you just want to wipe. Kind of make sure you got a pretty good area right there. And you wipe it. And here's the key. Kind of just give it some air. Let it dry. No rush here. We're good to go. Once you feel like that it's pretty dry, then you should be ready to go. I feel like the stomach hurts a little more depending on how much fat you have on your stomach. So if you're fairly skinny, I would probably stay away from the stomach and use more of your leg. Even though I am a little overweight, I still tend to use my leg just because there's something about the stomach that I'm not too keen on. Okay, so that's dry. So now what you want to do, take your pen. You have a number 1 and you have a number 2. So obviously, what you want to do is you want to take the number 1 off first. That's the cap that's over top of the needle. Okay. As you can see here, the medicine's in there with a black line, excuse me. Once you've dispensed all the medicine into your skin, that will be yellow after that. Okay. So you take the second one off. Now this is where you want to be kind of careful because obviously the pen is ready to go. You don't want to accidentally push that because the medicine will go everywhere. So I'm going to attempt to show you this. Let's see if I can. Well, it's not working the best, but anyway. So what you want to do is you want to take and you want to pinch your skin till you get a nice little area. Sometimes it takes a little bit to feel around and get what you need to get. Once you do the pinch, then you put the needle right on where you've pulled the skin up. You want to make sure you hold that up, okay? And then you put the pin on. And you inject. So I'm injecting right now. Obviously, there's a little bit of a sting. Not the most pleasant feeling in the world, but it's definitely not the end of the world. Okay, so I just gave myself the injection. And now you can see right here, the yellow marker is up. So that means that I have received all the medication. If you look there's a little bit of blood coming out, so that's where you're going to want to put your Band-Aid, obviously. Make sure you put your tops back on the spots they came in, and then you're going to want to dispense of this in a biohazard thing, which you can get pretty much from any pharmacy, or the pharmacy I get my Humira pens from was nice enough to get me one. All right, sorry that wasn't the best video in the world, but if you have any more questions about that, let me know. Humira is not really that big of a deal. Obviously it hurts sometimes, but it definitely has healed my ulcerative colitis. It has put me in remission after 20 years. I've done Remicade, I've done prednisone, I've done everything in between, and the Humira has been the one that has finally gotten me fully in remission after a year or so. So, not promoting the drug, I don't work for them or anything like that, but it is the one thing that has been working for me thus far. Although, keep in mind, it took probably 5 months before I actually saw no symptoms whatsoever. So keep that in mind. Don't get frustrated. All right, everybody take care. Hope everyone's healthy. Try to get healthy. If you have any questions, please let me know. I'll be more than happy to talk about my experiences for the past 20 years and every medication possible that I've been on, which has been pretty much everything. And let me know. Thank you.